Dr. Lee.
Hi.
Hi, we have Mr. Reese here. He's a 55-year-old gentleman, and this is Ginny, his wife.
Hi, Mrs. Reese. I'm Dr. Lee.
Hi, Ginny.
I'm going to look after Wally tonight.
Alright, thank you.
So according to Ginny, they arrived into ER and Wally suddenly had a muscle weakness on the right side of the body and was complaining of severe headache. Ginny gave him Panadol at home, which did not help with the headache, and he looks really unwell, so she brought him here.
So where are we up to?
So I have done a set of ops on Mr. Reese. Mr. Reese is having right side hemiplegia, and his right eye is non-reactive to light. His BP is 185 on 55, temperature 37 degrees, pulse 80, BSL 6.7. The rest rate is 12 per minute. Oxygen saturation is 90, so I put him on 6 liters of oxygen via the Hudson mask. He is having normal saline running for maintenance via the IV cannula. ECG ruled out myocardial infarction, but I've sent the bloods to confirm. He is due for another set of ops.
Okay, thank you.
Thank you.
Mr. Reese, how are you today? I'm Dr. Lee. I'm going to look after you tonight. Let me see what I can do to help you. I'm going to ask your wife some questions to try and get to the bottom of what's going on.
Sure.
Mrs. Reese, has your husband ever had a heart attack or a stroke before?
No, but his father died 5 months ago from heart attack.
Can you tell me what happened before you brought him here tonight?
Yeah, sure. We were watching news in a lounge, and then I heard a dropping sound. So I looked around and found the TV remote control was on the floor, and it was in his hand. So I saw Wally leaning on his right hand side, and he was complaining a terrible headache. So I took the Panadol, and he had a Panadol. When he was drinking the water, I noticed the water dripping at the right corner of his mouth. It seems like he had problem with swallowing the water. So we waited for a while, and it seems his headache got worse with the Panadol, and he looked terrible. He was sweating. So I decided to bring him here.
Before you brought him in, did he ever stop talking or go unconscious?
No, he sort of do stuff while I was driving. I woke him up when I parked the car here, and he was awake.
Thank you. Can you tell me about other medications he may be taking at the moment?
Yeah, the GP said his blood cholesterol level is a bit high, so he's taking drugs to reduce that. And he's also taking drugs to reduce his blood pressure as well. And because his father died from heart attack, so GP also asked him to take aspirin every day. But it upsets Wally's stomach, so he does not really do it.
Thank you. And is Wally a drinker or a heavy smoker?
Not really. He quit smoking 5 years ago. Before that was a pack a day. And he only had a couple of beers when he went out for sports with his mates. Other than that, nothing else. Doctor, what's wrong with him? Is he going to be okay soon?
We're not certain. We need to run some tests. We should get the results back from the first of those tests within a couple of hours, and then I'll come back and talk to you once we have some more information. It looks to me at this stage like he's going to be in for a few days.